Welcome to our podcast. My name is Trista Bash.
And I'm Megan Wheeler. Today we're diving into the world of trauma-informed care, therapy services, and how it relates to substance use. Joining us are our two guests.
Caroline McCourt, an emergency preparedness coordinator and community health planner, brings a lot of experience in trauma-informed practices and emergency response strategies.
And Molly, a licensed professional clinical counselor, brings her expertise in providing mental health services with a focus of healing and recovery.
Together, we'll explore the importance of trauma-informed practices. But before that, do you want to introduce yourselves?
I'm Molly. I'm a therapist. I've been in mental health since 2006. Currently work with ages kindergarten through 12th grade.
And I'm Caroline McCourt. I work with Faribault and Martin County Public Health. And I have recently been trained in trauma-informed practices, but trauma-informed care and practices and principles is something that public health has been working in for a few years now.
Caroline, what exactly are trauma-informed practices, and why are they important for individuals and communities?
Well, I am very glad that you asked. Most plainly stated, trauma-informed practices or trauma-informed care, those terms can be used interchangeably depending on if you're talking about trauma-informed practices in a healthcare setting or just in your general community setting. So trauma-informed practices really focus on how we can take the knowledge and science around trauma and how it impacts us and infuse that knowledge into our workplaces, our organizations, and communities to make them less harmful and allow for the opportunity for people to thrive. A program, system, or organization that is trauma-informed really follows the 4 R's as defined by the Substance Abuse Mental Health Services Administration, realizes the widespread impact of trauma and understands the multiple pathways for recovery, recognizes the signs and symptoms of trauma in clients, families and staff and others involved in their systems, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and it seeks to actively resist re-traumatization. So it's not focused on individuals, but on systems. And this is a main area in which trauma-informed care and trauma supportive services differ. The specific services are generally for individuals who have experienced trauma to help facilitate that healing and recovery process, whereas trauma-informed care and systems really approach or trauma-informed principles and care is really an approach based on the knowledge of trauma aimed at ensuring environments and services are safe and empowering and healing for service recipients and for staff.
Thank you. How have you seen trauma-informed practices being used in our community, and where do you think they should be used more?
So we're working to provide trainings in the school setting. It is fairly new, and so I haven't had much of an opportunity to really go out into the community. So I'm hoping that this podcast maybe sparks some interest. And if you're curious about learning more about how this impacts your organization or how your organization can do more to learn how to be trauma-informed, please check out our website at www.fmchs.com, our Faribault and Martin County Human Services website. I hope that's okay to make that plug here in this podcast, but we have a lot of information there as well, and it's one way you can reach out to reserve a training or just even learn more about a training. But it's important for our community because it allows us to show up as whole people wherever we are. Trauma-informed care is more of a mindset shift, and that's what we're learning in some of our trainings with schools, that oftentimes when we do these trainings, we just want a checklist. We want, okay, we've done this, we've done that, we're good, we're this stamp of approval. But it really is more of a mindset shift in how you operate, how you include the client, how you include your coworkers, from we're totally different people and I can't learn anything from you, and a hurried work culture, to more of a mindset of infusing that mutual respect and collaboration with others, seeking to empower others and those who have historically been oppressed and not allowed a seat at the table. And this is referring more to just community collaboration work as well. I realize you can't always invite community members into your leadership meetings at a private organization, but in community work, certainly wanting to work with and not just for people, making environments physically and psychologically safe for staff and for all service recipients, for people to be in and around, having that knowledge that while we may be different, there are a lot more things that we can relate within each other, and that we're all humans. We all have goals and wants and needs, and some have had more resources throughout their lives to be able to meet them and attain those needs and achieve things. And some have had, you might consider, if you hear someone's backstory, that, wow, they never really had a chance. when you look at the environment in which they were raised in or the things that maybe they experienced while they were growing up. But if we take more of a trauma-informed approach to our systems and organizations and communities, it really furthers the healing that can happen in relationships, allowing people to meet their full potential regardless of their start.
So can you share some of the benefits you've seen using trauma-informed practices within your community?
As I should give the caveat as well, we haven't had as much of an opportunity to fully see the benefits quite yet. But in working towards this, working to shift the focus towards skill building and strengths-based and healing-centered care. So transforming spaces and practices and procedures and policies and working towards a complete culture change. And so we've seen this occurring in schools. And so beginning to see it in mentoring organizations as well. We've been working through this at community health or in human services, and looking at like the language that we use when we're talking to each other, the language we use when we're talking to clients, just the environment that's set up, and ensuring that we have a welcoming environment and that we're also working to empower our service recipients, but even our staff. I mean, we all probably know what it feels like to be talked down to or to be having a decision made for us without us being able to provide input on, or even feeling like in a work organization that you don't have a voice and you don't have a way to even provide feedback. So utilizing some of those pillars to ensure that there is a safe process to provide feedback and that your feedback is considered and taken, or that you feel like you can psychologically and physically be safe in the environment that you're in. So utilizing those pillars to just ensure that workplaces are safe as well, and seeing it come out within just how we work together, how even in our own department and community health works together to support each other.
Thank you. Molly, from your experience, how does trauma-informed therapy differ from traditional therapy, especially for individuals who have experienced trauma?
For me, the biggest difference between a trauma-informed therapy as opposed to maybe some different ones is just kind of the mindset and the lens that the therapist kind of looks through, as opposed to asking the question, what's wrong with you? Kind of asking like what happened to you and kind of trying to get their story, their experiences. Some therapies spend a lot of time on symptoms and behaviors and modifying or changing them. And then in a trauma-informed approach, you want to look at, obviously you're going to look at the symptoms, you're going to look at, what's going on, you're going to look at the behaviors, but you're also kind of seeking to understand what's behind that. I use an iceberg a lot of times in therapy, and so we kind of see, look at what people see and then what people don't see, and those are the things that I really try to focus on, because I can modify behavior, I can, put goals, and I can, we can modify behavior, but if we're not addressing what's really causing some of those symptoms and behaviors, then it's just going to come out in a different way.
Could you explain how trauma-informed practices can intersect with substance use issues, and what are some common patterns or challenges you've encountered?
Okay. So when I first started in mental health a long time ago, it was, you kind of had your lanes: substance abuse therapy did substance abuse, mental health did mental health, and those two did not intersect. If you were in for mental health and a substance use issue came out, you kind of referred out and said, oh, that's substance use. Like that's not my area, and kind of vice versa. We are seeing a shift in that, because I don't think you can tease the two out. So oftentimes the biggest patterns I have seen where they're intersecting is when someone experiences trauma or stressful or, adverse experiences, they have symptoms, they don't feel well, they might be really anxious, they might be having nightmares, they might be feeling sad, depressed, whatever, and they just want to feel relief. And so one way they might find relief is through substances, and so they'll use to self-medicate. I've seen people too try traditional medications, going to the doctor, trying stuff, and it just is a process, and it's a lot of trial and error, and it's frustrating, and people don't feel well. And so then I just see that people kind of take it into their own hands. I see sometimes they don't want to feel, so they use substances to not feel. Sometimes they want to feel something different. Sometimes they want to forget for the moment. But I think it's deceiving too, because those substances might help relieve symptoms in that moment. In the long run, it doesn't really address or take care of what might be causing them. And then not only do you have whatever kind of was causing the symptoms, you also now then potentially have addiction difficulties, which is hard to overcome and is a lifelong kind of battle for some people.
Thank you. Molly, could you describe the therapy services you provide for individuals who have experienced trauma and how you incorporate trauma-informed care into your practice?
So I've been trained in and have a background extensively in various trauma-focused therapies. There's something called EMDR, which is it looks at eye movement and helps people reprocess their trauma through eye movement. There's a trauma-focused cognitive behavioral therapy, which does more kind of narrative. They create kind of their story. There's something called brain spotting, where you kind of the theory is where you look is how you feel, and it can kind of help get out the trauma, and just kind of feel like, depending on the situation, depending on the age, depending on kind of, client's preference on things, is kind of how different types of, therapy someone might choose. I think the biggest thing in regards to trauma-informed is providing a safe and secure place for people. If they don't feel safe and secure, they're not really going to address whatever's kind of bringing them in.
How do you address the unique needs and challenges faced by children and teens who have experienced trauma in your therapy practices?
I try to approach all my work, whether it's someone who I know might have a trauma or doesn't have a trauma if they're coming in, but just building a safe and secure relationship. I know that no therapy is, I can have the best tools and I can do everything right and check everything off, but if they don't trust me, it's not going to work. I think there's a statistic out there like 60 or 70% of success in therapy falls on the relationship between the therapist and the client. And so my hope is people who come in and that I'm meeting with, that they trust me and can feel safe and secure. And if it's not me, then I can help them find someone that they can. And then especially for individuals with trauma, that if they've had some broken or unhealthy relationships in the past, sometimes building trust with others is very difficult and it may take a long time, but just kind of allowing the time and the space for them to build a relationship in a non-judgmental way, and to kind of help them with kind of what they're coming in for.
Thank you. What are some specific ways you've seen individuals benefit from trauma-informed care in therapy sessions or other support services?
I think the biggest thing that why people seek therapy, or maybe, parents seek therapy for their children, is to have, a symptom or behavior reduce for whatever's bothering them. So over time, obviously I've seen kind of symptoms reduce. Obviously that's a helpful thing for them. Also just allowing people to have a safe and secure place where maybe most places in their life might not have been safe and secure. They're also seeing a trusting and respectful relationship. And also it just is a place for them to understand their brains, how their brains work, because we all have unique brains. And so it's, for them to kind of explore that for them. And therapy will never kind of erase traumatic events, though some people wish that was the case, and there's sometimes I wish I could take that away. But the hope and kind of the goal is to not have kind of the intensity or the frequency of the distressing, whether it be memories, responses, nightmares, whatever. And then in helping the event be a part of their story, not becoming their whole story. Because we have seen if people don't address, things that have happened, it kind of starts playing a role in their life for their whole life. And so, I use that a lot with people I work with. Like we just, I can't take that chapter away. But I don't necessarily want that trauma or those experiences to be the rest of their life.
Do you also do cognitive processing therapy?
Like letting them talk through their therapy? I mean, yeah.
Or would that be considered a form of the trauma-informed
Yeah, so
services?
there's a trauma-focused cognitive behavioral therapy would be kind of more of that talk-through thing.
Okay.
They might write their story, they might draw, they might timeline different things, however kind of they want to come up with it. You can kind of process trauma through kind of cognitively and talking, but we have found that to kind of trauma is stored in different parts of the brain, and so talking sometimes takes a little bit longer to get to that, where some other different types of trauma or therapies can address it or kind of target the parts of the brain where trauma is stored.
Thank you. I was just going to share, it just feels like a good time to share.
Yeah.
Just some of those therapies, even as adults,
Right.
can be really helpful. It's
Yeah.
not always just for children or the immediacy surrounding the trauma, that you
Yeah.
can still share and benefit greatly from trauma supportive services, even if your trauma was years ago. One of the things we talk about in some of our adverse childhood experience trainings is it seems like some graphics or things that talk about ACEs, like they really hone in on that negative event instead of really, like you were saying, it's not the whole book. It doesn't have to be the whole book. It's one chapter. Or if you're making salsa, you don't only use cilantro in your recipe. Like it's something you sprinkle on the salsa. It's just part of it, but it doesn't have to be that whole piece, even though it can certainly feel like that before you've had the chance to heal in relationship and through therapy.
So, in our area, what resources are like available to individuals who have experienced trauma, and how accessible are those resources for them?
I'm going to talk about some of, like, obviously there's individual therapy, family therapy. Sometimes people, depending on kind of symptoms or things that they're experiencing, they might use it like an occupational therapy that might be beneficial to them. Psychiatric or medication management. Sometimes that's done by primary care. Sometimes that's done by a psychiatrist themselves. I've seen, social workers, there's supports at Human Services, there's case management to help mental health, both adults and children. There's skills workers and arms workers, which are, I guess the best way I kind of describe it is, paras in school, but it's specific to kind of help through mental health and build some skills and address some of, maybe those things that they want to work on or need. And the case management and skills aspect are both for children and adults. I don't know, Caroline, if you had more kind of...
Well, there are specific services available in our area, but also when you think of things that people might need to heal, there are resources in our community such as like spending time in nature, spending time outdoors, which might be very different. I realize that healing can happen in a lot of ways,
Right.
but nature actually can be very healing. So spending some time, just time in thought, time in, even doing some of your own processing, but in a safe space where you are. There are tier one things, or things that happen that can benefit everyone. So if you think of some of the things that some schools are doing, is teaching mindfulness practices, using social emotional learning, teaching how to manage emotions. When you think of the cause of trauma, oftentimes it can be from someone who's not really learned to manage their emotions, and they take it out and cause abuse or decide to act in some of those ways. So really going far upstream in the public health world of teaching coping skills and social emotional learning as an example of just things that can happen that promote positive coping skills and positive emotional regulation at just a ground level. So people are getting, our students and kids are getting that information that hopefully they take on into the rest of their lives, so that they do have emotional regulation skills, they do have positive communication skills, they do have responsible decision making. It's not the end all be all, of course, but it's a good ground level opportunity to learn that way.
I think people also will look towards, faith or belief systems or supports. I think we are very rural, and so sometimes, textbook like this is kind of areas to look for is not always super accessible, or they might be driving an hour, which sometimes is a barrier, in regards to substance abuse treatment, especially for adolescents. Like it's incredibly difficult, even non-existent. And so, being able to kind of team together, especially in rural areas, or looking at some of maybe those non-professional supports, I think, even, having trauma-informed schools, or having, like people who are with you more than maybe a therapist or a doctor, or, on a day in and day out, like those can be helpful services too, that are less kind of professional.
Okay, can you discuss the difference between trauma-enforced practices and services for individuals with trauma? How do they complement each other in providing support and healing.
So think of trauma-informed care and practices as the practices for the organizations and systems, whereas the therapy services are really for that individual or family. They complement each other in that they build on each other, and having access to therapy can really help that healing process, either expedite it or just help with that healing process from the specific trauma that that individual has experienced or that family has experienced. The trauma-informed care principles help systems like the workplace, school, community to follow those 4 R's of that. Let's see if I can remember it off the top of my head. The resisting, the recognizing trauma, resisting re-traumatization, recognizing multiple pathways for healing, realizing the signs and symptoms of trauma, but having all those pieces in play, but then utilizing the 6 principles, which, without calling them out earlier, we've heard some of the themes that have been said as far as safety, having that safe environment, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and having that cultural humility as well.
So looking ahead, what steps do you think our community can take to further promote trauma-informed practices and make sure there is enough support for individuals with trauma?
I think as a professional, obviously, this is my world. This is what I do day in and day out. But those are also things that, through conversations with, whether it be other professionals, just people I know, community members, just, helping them kind of understand or, look at it a different way, working, on how, in my work, I may be sitting with a client, but I also may be collaborating with teachers. I may be collaborating with social workers. I may be, all these other people who play a role in that client's lives and families. And so helping them kind of have a different look at maybe something in a different light, or looking at maybe let's look underneath what's going on, seeking to understand as opposed to judging. I think sometimes when we can just kind of take a step back and help others take a step back to try to figure out maybe what is driving what we're seeing or what may be influencing it, I think it can just kind of be helpful. And I think just in conversations like this and in conversations with providers and teachers that, just using the language like Caroline was saying earlier, being mindful of our language and how we're explaining it, and also just, sometimes being able to say, yeah, that, but have you thought about it this way? And, it can help kind of further promote that understanding in a trauma-informed way.
Our community health resiliency team focuses on looking at the priorities that were a result of our community health needs assessment conducted with stakeholder input, and so community members provided feedback on what their top concerns were, and among those top concerns were access to mental health care, substance abuse prevention, and looking at increasing mental health and resiliency within a community. And so collaborating with public health is among the strategies and things that we can continue to do, but also look at what your organization can do to be trauma-informed. What can your faith-based community or your mentoring community, or you and a group of friends just want to talk about trauma-informed practices. We can have that conversation too. I always need practice in the training and looking at what this looks like from a community lens, but also what it looks like from an organization lens. We've been going through a year-long collaborative with a lot of our schools who have participated in learning what it even means to be a trauma-informed school. We mentioned people like checklists. It's not as easy or as simple as a checklist. It does take a mindset shift. And it's not saying that just because someone has experienced trauma that whatever behavior is happening is okay and you just need to handle with kid gloves, for lack of a better analogy, but just have that different approach, as with Molly had shared before, of not what is wrong with that child, but what happened to that child. What happened that this behavior is being elicited? Using a different approach might get you a lot farther than just a typical, like, what's wrong with this person? Like, having some of that empathy and understanding can really help us to have more better functioning adults, better functioning systems and organizations, and to be able to show up as our whole selves, which I think most people would appreciate, being able to show up as their whole self, wherever it is that you work, or wherever it is that you live, learn, work, pray, and play.
So if someone who struggles with trauma wants to take their first steps of healing, what would you suggest they start with?
There's lots of different, places to start. I would say it's going to be kind of dependent on age. If it's families with children and, they know their child might be struggling, I think a good first place to start is school social workers. If, it's a child too that needs someone to talk to, they're probably, school social workers are really going to, or their counselors are really going to be the first place and probably the quickest place. I think people can talk with primary care providers, their doctors, nurses. They can also help kind of connect resources. There's many outpatient mental health that, therapists in the area that they can reach out to. There's even outside of Fairmont too. I know that gets difficult when you're talking about kind of long-term human services. There's options and supports there. Faith-based, I'm sure if you would go to any, if your church or, wherever, they also would have resources to kind of reach out to. But I think it's just, finding someone, and if that person doesn't know, if asking them, can you help me find someone? But I don't know if I missed anybody.
Someone you trust. Talk to someone you trust, and they will likely point you in the direction to, or confirm that this is worth talking about, this is worth sharing. We can thanking them for sharing that information with them too. But a trusted individual within whatever that sphere of influence is. If it's not a parent, finding someone that is a trusted individual you could share with.
Coaches, teachers, if you're music, just kind of finding someone, especially if you're a kid, reaching out to an adult, and an adult will help kind of navigate the system. It is not I'm a part of that system, and sometimes it's hard for me to navigate. So if you're not familiar with things, but hopefully if, as a kid or adolescent, if you're reaching out to an adult, they'll be able to kind of help navigate. If you're adult, you can reach out to other adults or supports that you have in your lives to kind of get the resources or supports, or, being able to find kind of what you're looking for. So
if you're an adult and you are employed, you can utilize the Employee Assistance Program. I believe the majority of employers at least have access to some version of an Employee Assistance Program, at least get you started.
Say if someone who struggles with trauma reaches out to a friend who's also a young person or a teenager, and the person they reach out to is what do I do with this? Because if they don't know what to say or what to do with it.
I think obviously that friend is trusting or, of you. And I think I am not naive to the fact that, kids are going to talk to kids, sometimes feel way more comfortable talking to other kids, but then that can be very difficult, because then, then you're now I'm a kid, and now what do I do with this? So I think sometimes, what I've encouraged, kids or adolescents that I have worked with is then finding, the friend who, sharing with a trusted adult, saying, okay, maybe that's a parent, maybe that's, the child's parents that's reaching out and is struggling, maybe that's a teacher, maybe that's a social worker. And sometimes I think people or kids might be afraid to do that because they don't necessarily want to break trust. But, especially with mental health or trauma or safety concerns, that's a lot for, a child or an adolescent to kind of hold. And I kind of say to people all the time, I would much rather be sitting and having a conversation with you being mad at me and working through that than, something worse happening. And so, I again would encourage that friend that heard the information, finding someone that they can share with, an adult, going, and helping the friend get connected, even though, that friend might have felt comfortable talking with you, but they might have not known who to go to, maybe not comfortable, but then, you can go with them. You could, say, I'm going to share this, but I would find just an adult that then can help both of you kind of cope with or deal with kind of whatever's going on.
I would like to bring up, I hope it's okay to bring up Brene Brown. She has a lot of research on empathy and on how to have some of those conversations, and just the acknowledgement that must be really hard. Thank you for sharing. How can I help pieces of it if you're not really sure how to respond. But she has done a lot of work in this field as well and is just an amazing resource with her own podcast. But her video on empathy really came to mind as well, of just that sitting with someone when something's really hard, but also finding that person to be that adult to be able to share that with too.
And I think too, just as humans, we want to fix things, and sometimes there's not anything we can do to necessarily fix it or take away the pain. And so, oftentimes, and I still do this as a therapist, like I try to make it better. And obviously I don't want people to be in distress, but, just being able to sit and listen. And obviously they came to you because they felt comfortable and supported. And that's a lot at times for youth to hold. And so, being able to support them and care for them and, provide, safety and security, and also getting them the support and help they need is important. So.
And that wraps up our episode. We hope you've learned something about trauma-informed care therapy services and how they relate to substance use. A big thank you to our guests, Caroline and Molly, for sharing their expertise with us. Remember, kindness and understanding can make a big difference in someone's journey towards healing. Until next time, take care.